right, welcome back to Dr. Moses' YouTube channel. And on today's episode, we want to talk about urinary tract infection. And number one, why do women have more UTIs than men? Number two, what are some of the risk factors that contribute to having more UTI? And number three, what are some of the signs of UTI? And number four, what are the things you can do at home to prevent recurrent UTI? And number five, let's demystify cranberry. Does it work to prevent UTI? Let's dive into it. Number one, women have shorter urethra. And because the urethra is very short, meaning bacteria can travel faster into the bladder than men, and so they get UTI. Number two, some women during sexual intercourse, they can have UTI because the bacteria can be pushed into the bladder very quickly, and so they can have UTI. Not all women have UTI with sexual intercourse, but some women do have UTI even after sexual intercourse. Number three, hormonal changes. Now, as women get older into their menopause, the estrogen level decreases. Now, estrogen has a protective effect on the bladder, and so it prevents bacteria from attaching to the bladder and therefore preventing UTI formation. So as people get older and the estrogen level decreases, they are prone to getting more UTI. Number four, people who hold urine for a long time. If you have the habit of holding urine for a long time without peeing, that is a big risk factor for also getting UTI. Number five, if you have certain anatomy dysfunction in your genitourinary system, that can also prone you to having more UTI. And number six, if you are immune depressed or you have things like diabetes, that can also cause you to have more UTIs than the ordinary person. Now, what are some of the signs of UTI? Most people who have had UTI before, they know that they have a burning sensation when they urinate, or they have more frequent urination, or you can have blood in your urine, or you can have urgency of urination where you want to pee, but we go in and you're not able to urinate, or you can have low pain around your bladder area when you urinate, or sometimes you may have blood in your urine, or you can have a foul smelling urine, or you may have more urinary incontinence. That could be a sign that you have UTI. And in the elderly people, it could just be a change in their mental status where they get confused, they don't know where they are, or they are more fatigued or weak than usual. That could be a sign that they're having UTI. And if you haven't sign of UTI, what do you do? Well, the best way is to get a urine sample, get a urine culture, so that they can isolate the right organism and give you the right antibiotics. Now, some people are not able to go to the doctors. They do a phone visit or a televisit, and they get prescribed empiric antibiotics. Now, there are certain antibiotics that has been approved by the FDA to target certain organisms, and they can work for you. But sometimes these organisms are developing resistance. So if you can really go to the doctor's office, the best way is to go in and get a urine culture. Now, how do you prevent UTI? The good stuff. What are some of the things you can do to prevent UTI in a home setting? Number one, drink a lot of water. There was a randomized control trial where they compared two groups of women. The first group, they gave them the usual fluid they were drinking at home. And the second group, in addition to the usual fluid they were drinking, they added about 1 liter and a half liter of water. And guess what they found? The second group that were drinking more water, in addition to the usual fluid they were taking, there was a 46% reduction in recurrent UTI. That is huge. So make sure you're drinking water. Number two, cranberry. Let's talk about cranberry. Now, if you just go to the store and you buy a cranberry juice or you buy a cranberry peel, that might not do the trick for you, because the active ingredient in cranberry that works is called procyanidin. Procyanidin. That is the active ingredient that prevents the formation of recurrent UTI. And what I found out was that when people took cranberry that contains procyanidins, about 36 milligrams of procyanidin daily, they were able to prevent UTI even as compared to taking low dose antibiotics. Number three, if you are in your menopause or postmenopausal, you're getting more UTI, getting an estrogen cream using vaginally will prevent you from having frequent UTIs. There are other stuff out there on the market on so undergoing studies, but there have not been any proven results clinically, and so I'm not going to bore with those. But if you do these three things, you are going to reduce the amount of UTI you get on a weekly, on a monthly or a yearly basis. So if this has been very helpful to you, information, I want you to subscribe to my channel, give me the like, and also leave a comment for us. And if you have done things that have worked for you to prevent UTI, I want to share with your audience so that they can also benefit from it. Until then, I say stay well, and I'll see you on my next video.